I can't tell you how excited we are to welcome you all to the 11th Annual Connected Health Symposium. It's going to be a breakout event for so many reasons, and the content we're really excited about. Of course, there's always great networking. We have significantly more exhibitors this year than we've ever had in the past, so please visit them all. They all have really interesting solutions for you to look at. So lots and lots and lots of fun over the next 2 days as we immerse ourselves in this growing market called connected health. You know, the market really is growing. There's so many big names now in the market. Samsung, of course, has been in it for a while, but Apple, with their big announcement recently, has made a lot of news. A lot of people really looking carefully at what they're doing. When they announced earlier, they of course brought both Epic and Mayo Clinic into the fray, so lots of big brands now in the connected health space, and it feels very, very real, which is exciting, and it should be a nice lift to our conversations over the next couple of days. We're doing a lot of fun things at the Center for Connected Health as well, and I urge you to go by our booth, see the connected health people, the Wellocracy folks that are in tandem with them at our booth. I did want to mention one exciting thing that we're doing as well, because it, to me, was a groundbreaking effort, and it's a partnership with Daiichi Sankyo, which I think is a first in the industry. I haven't heard of this. And that is that we're helping them. They have a new therapeutic that they're going to bring to market, and we're helping them develop their mobile solution, which will surround that therapeutic as it goes to market. And we've been talking to folks from the pharmaceutical industry for a number of years at the center, and they keep talking about moving beyond the pill. And there's a handful that are making sincere efforts to do that. I'm sure it's just as hard for them to move beyond the pills as it is for us as providers to take risk and go away from fee-for-service. But Daiichi Sankyo stepped up to the plate and said, we want to do this. We think that we have a real opportunity with this particular molecule to add value in the marketplace by surrounding it with a mobile solution. And we're doing that together. So I'm quite excited about that. I wanted to let everyone know that that's, again, one of the many exciting things coming out of the Center for Connected Health. Well, you've had presentations and conversations, dialogue, debate for 2 days now, and it's time to call the question. Is 2015 going to be the year for mobile health? Well, you'd say there's a lot of recent enthusiasm. Companies like Samsung, Apple, Intel, Google, Microsoft are all getting into the health business. In fact, it sort of feels like exuberance, but you'd have to ask the question, is it irrational exuberance? Let's think about that for a minute. Santayana said to us, those who do not learn from history are doomed to repeat it. What do I mean by that? Well, how is Apple's Health Kit going to be any different than what was once touted as the breakthrough, which was Google Health? Most of you remember Google Health. It was this exciting place where you could store all your health data on a website, and nobody really came. They shut it down. Samsung has had S-Health out for 3 or 4 versions now of the smartphone, the Galaxy smartphone, and not much is happening there. And of course, Aetna just shut down their mobile health initiative, CarePass, because they built it and people didn't come. There's a theme here. Now everyone's looking out for the smartwatch to be the savior. I'm going to leave that story because we don't know, but I'm a little suspicious, I'll confess. So when people think about developing mobile success stories, they think about this, Snapchat or WhatsApp or Instagram. And I do think there are a lot of entrepreneurs who think, well, God, that seemed like that was easy. Why can't we just do that for health? Let's develop a health app that's like as cool as Snapchat. I'm going to pose to you that that's a challenge. So the design strategy here is give the people what they want. There's something fundamental that people want to do. Share, in this case, message, what have you. They want to communicate, they want to share. Can we translate that into the design of mobile health apps? And if we did, and there are, of course, some out there that are successful, this is the kind of person that we'd attract. Not a bad thing, but as healthcare providers, frankly, if you're this fit and this connected, we have other people that we've got to spend our time on who are much sicker and much less connected. So we'd be really wasting our resources to try to build apps that would attract this kind of individual. It's really these kind of people that we need to bring on to mobile health. And they're not coming, which is what I want to reflect with you on. So if we're going to get it right, this is the crowd we have to get on board. So it seems like health apps might be different. Well, there's some evidence for that already. 1 in 10 adults, I guess, now owns a fitness tracker, but within 6 months, a third of them end up in the drawer. Something's not quite right there. 80% of health apps that are downloaded are abandoned within 2 weeks. Not too much stickiness there. So again, we haven't got anything near like Snapchat on that front. And maybe it has to do with the fact that the people designing these are either doctors themselves or they bring doctors in to verify their work. And as doctors, we have this thing where we know what you need, but you as patients come back and maybe don't want it. Maybe you don't want it that way. That's why I have the castor oil picture there. It reminds me of my mom giving me castor oil. She knew I needed it. I didn't want anything to do with it. So health is different. Health is different. Here's a pretty dramatic example of that. Now, you all know you check these devices incessantly, 150 times a day by some estimates. But I'll show you a little experiment that we did with 2 different hub devices in a program where we monitor blood pressure. And the simple part of the story is if you happen to be a patient with a device on the left, you had to push that button to upload your blood pressure. And if you had the one on the right, passive data upload. You take your pressure, it's uploaded. Now we know from other research that we've done that uploads, which are a proxy for engagement, correlate with outcomes. People who upload more in these remote monitoring programs, they have better clinical outcomes. So uploads are important. And lo and behold, the people who had to push the button were 3 times less likely to upload. So you tell me, if you're busy checking your phone 150 times a day, why I can't get you to push a button once to do something to improve your health. There's something really, really different here. And I would say the challenge that we face is that we, as people who design health apps and healthcare providers, are still stuck in a world where we think that as long as we educate you, that somehow you didn't know smoking was bad, or somehow you didn't know that having high blood pressure was bad for you. That if we educate you, you'll be inspired. And my comment here is we can't confuse education with inspiration. Now, we have to get this right. So the answer to my self-posed question, Mobile Health 2015, if we can get this thing right about inspiration and engagement, we'll have a chance. But if we don't, 2 unfortunate things will happen. We'll have another tech bubble and another yawn, a lot of investment dollars chasing products that don't work that well. But even more importantly, and you heard it just now from my CEO, you heard it yesterday from my boss, the chief medical officer, we need this stuff. We need this stuff to succeed in this new paradigm. It can't not work. So we need all of you to help us solve this engagement problem. Engagement. Engagement is king. And I know it's an overused word, but it is king. So what I want to do is talk about ways to engage through technology that I think we have to get right. And I have some companies that are examples. The bad news is no company's got this right. That's why I'm pleading with you that we all get it right. The good news is some companies are doing some things right some of the time, and I'm going to illustrate some of those. These are not companies that I have any particular interest in financially. This is not meant to be a contest about who just got on my list. They're just examples. So bear with me as I go through this and talk about tools for engagement. And they're going to be as follows. The first one is frictionless technology. We've heard actually other people refer to that the last couple of days. The second one is getting social right. The third one is personalization. And the last is fitting into everyday life, relevance to everyday life. So let's unpack each one of those. Frictionless is easy. When I get a product now that works well, whether it be the new iPhone or any of these, they're all built, and actually most of the mobile apps that you download and use are the same way. They're built on this concept that there's no user manual. You don't need a user manual. You just go. You just start using it, and it's intuitive. I can't think of a healthcare app that's that way that we design for patients. I can't think of a healthcare device that's got there yet. So that's a challenge. And if I can't get you to push a button, can I get you to pair something with Bluetooth? We have all kinds of stories at our center of patients who gave up on projects that we had got them excited about because the technology just failed them and they got sick and tired of trying to get it right. This is a problem, frictionless technology. So a couple of companies that are doing work in this area, Validic is one. They've got this ecosystem where you can plug all these devices in and show it in one spot, one place. That's interesting. Tactio is on the floor here. They're another. And as I said, these are just examples. It's a big problem to solve. You can all help solve it when you design these things and make them so easy to use that your 3-year-old could use them. That's the request that I have on frictionless. Social is probably the most important motivator, as we've learned over and over about the various motivators. People talk about games, incentives, and so forth. Social is really powerful because we all are part of a tribe. We want to be part of a tribe, and we want to be seen as in the tribe in the right way. So to me, it comes in 3 dimensions. One of them is camaraderie, the second, competition, the third, which I think is most important for health, is visibility. Let's talk about each one of those quickly, and I'll give you some examples. So patients like me, who was represented here on a panel yesterday, I believe, they get the award, in my opinion, from Camaraderie, and you heard them tell their story. They've done amazing things, gathering people with a disease together and enabling them to help each other with that terrible disease, whatever it might be. And just that sort of reward system of I'm helping my fellow person who's suffering the same way as I am has gotten them very, very far. Very interesting that there's nothing in it for those patients except helping each other and what they learn from each other. That's a really interesting example of camaraderie. There are many I could have chosen for competition. I happen to choose Virgin Pulse. They have this workplace wellness strategy where they give everyone a tracker and then people compete. We've done competitions with similar technology at the center. We've done competitions with similar technology in various primary care practices around partners. We actually did it with our executive suite one time, and they always work. People pair off, or they form teams, or they compete solo, depending on their styles, but almost everyone walks more during the competition. So there's something here. I don't know if it's sustainable over long periods of time, but it's something that we should harness in our product design. And visibility is, again, I think unique to health because we don't want to disappoint the doctor. We don't want to disappoint the doctor's nurse. We want to look good when it comes to our healthcare. We're not going to share things socially about our health that are bad. And if we have anchors, as Gary just described, for connected health that are objective device measurements such as blood pressure cuffs or tracking devices of any sort, and those are being shared, people up their game. They bring their A game. And patients tell us this. These are 2 programs from our center, Blood Pressure Connect, Diabetes Connect. The reason I have them here, they've been very successful, as you can see from the data, but the reason I have them listed here is because we went back and asked the patients, what did you think about the program? And we saw 2 different themes. One was, I'm part of this program because I don't want to disappoint my doctor. I know my doctor's looking at the data and I want to look good in front of the doctor. Or, equally interesting and more malignant was, I quit because my doctor wasn't paying attention, or the nurse, or anyone in the practice, because for whatever reason, we haven't yet convinced people that they should do this stuff for themselves. That's an interesting psychology, but people seem more motivated by being watched than improving their own health. So visibility is very important. Personalization, so I like the story that I tell often of how we now use tools like Google, and Google knows what I'm searching for after I type into a couple of characters. They know that because they know a lot about me, but I feel good about that. Or I use Google Maps, and it's very, very accurate, and I like that, and I've given away a lot of personal information. How can we create healthcare products that are equally personalized and equally exciting? Well, we have a little bit of early knowledge on that based on a program called Text to Move, and actually Gary mentioned this program. I'll tell you just a little bit more detail about it, and that is that we were enrolling patients with type 2 diabetes. The goal was to improve walking behavior, and the trick was to gather 4 types of data about them in continuous variability. One was their motivation to change. The second was their actual activity level, as reflected by a smart pedometer. The third was weather data, which you don't see listed here. And the fourth was location data. And we put those into an algorithm, and then we sent out automatically, with no human intervention, twice-a-day motivational text messages to these individuals. Lo and behold, if you look at the data here, you'll see that the orange bar is a reflection of how well their diabetes did. 0.62 drop in hemoglobin A1C, which is better than a therapeutic, better than metformin, for instance. And if you were really engaged, the middle bar, a 1 gram % drop. So here we have a program personalized. People open the messages 80% of the time, and effective because it spoke to these people themselves and improved their health better than a drug. Personalization, really, really powerful. Now, relevance to everyday life is kind of a blanket term, so I've broken that one down as well. And I'm going to talk about subconscious triggers. Go where the consumer is. That's a really important one that we haven't yet learned in health. Focus on near-term goals. We always tell people that if you don't shape up, you're going to have a heart attack in 10 years. That's not particularly effective. And then finally, state-of-the-art design, which, again, there's a crying need for good design in healthcare. Everything that we design, somehow we don't bring ethnographers and designers in very often. Subconscious triggers, this is a fun story. This is a project that we did many years ago before the advent of the smartphone, where we asked if we could get people to apply sunscreen by sending them a reminder every morning, a text message reminder. And it went something like this. They'd get a message, as you see illustrated here, with a weather report and a reminder to wear sunscreen. And the group that got that did very well. You can see the graph, and the top line on the graph shows their adherence, which was very consistent and much, much higher than the control group, which did not get the messages. So we went back and we had to ask, what was so compelling about getting a daily reminder to put on sunscreen? And the answer that came back from the enrollees was, I didn't think about that, but I really like getting the weather report. That's what I mean by a subconscious trigger. It's get something in front of someone that they're interested in and fit your health message in underneath. Go where the consumer is. My hat gets tipped to WellDoc for this one. They've done amazing things. They were really the first people to say, we can take that coaching relationship and move it to a mobile device. You don't have to travel to get coaching. We can coach you right on your mobile device. And they've done amazing other things. They've built the company in incredibly powerful ways and been a beacon for so many other mobile health initiatives. But the first thing they did right was take the visit out of the picture. We'll get to the device that you have in front of you and we'll coach you that way. That's what I mean by go where the consumer is. And focusing on near-term goals, I have to tip my hat to Omada. Omada took something that is a really big challenge, which is pre-diabetes, and managed with a couple of interesting interventions, a connected weight scale and some other tactics, to get people reliably to improve their weight status, lower their diabetes risk over a short period of time by helping them focus on short-term goals and keeping them focused. So hats off to them on that one. As I said earlier, many, many different examples of all of these strategies, but I highlight these two for you here. And finally, when it comes to relevance to everyday life and good design, That was another hard one because in the consumer space, there's a lot of interesting designs, but MyFitnessPal has 50 million people using their software, which is really impressive in healthcare. And it's because I believe the ease of use and the design, which I pictured here. So I couldn't think of a better example of good design to show you than MyFitnessPal. Now, so that's a lot. There's one more thing that I want to mention, and that is the opportunity for big data. Underneath almost everything I talked to you about, there's a data play, an analytics play, and there are many, many interesting companies doing really interesting work. Now, I want to go back to the story I mentioned about how when you get the right product and it's customized and you're attracted to it like Google Maps or Google Search, and you probably all have examples of things you've been searching the web and you see out of the corner of your eye an ad for something and then you click and that's interesting and then you hit the buy button. So that could be a roadmap, but let's face it, getting you to buy something on impulse is much easier than getting you to improve your health. Otherwise, I wouldn't tell the story about pushing the button one time. That's why I use Teradata as an example for this big data opportunity. And Nick Van Goor was on a panel earlier today. They have done something really interesting, which is they have developed an algorithm. Now, it's in the financial services space, but I think it's analogous. They've developed an algorithm where they can find someone who's missed one loan payment, because if you've missed one, we can get you back. If you miss two, we pretty much have to write you off, I'm told. They've developed an algorithm to find someone who's missed one loan payment and then a strategy to get them back on the wagon. To me, that's interesting, and we probably can learn from them because that's a lot more like getting you to do something healthy. Well, what are the implications? Is 2015 going to be the year? Not if we think we're going to build them like Snapchat and Instagram. That's not going to happen, guys. It's not that easy. It's different. It's different. And if we don't get engagement right, I would say the answer is no. It's going to be another tech bubble or another sad story in healthcare delivery. We have to get this right. We have to get this right. And it has all to do with this engagement story. Again, some companies are doing some things right some of the time, so we can learn from what they're doing, and maybe there's a roll-up or a mix-up or some way to capture all this and move it into one platform, I'm not sure. But it's not, nobody's doing everything right now, and we need to do it right. It's going to be hard, but it'll be worth the effort. All right, well, that's it for Symposium 2014. Thank you all for being here. It's been a great 2 days. And we look forward to your feedback. We will be sending you all a survey, and we certainly hope you'll return again next year. Thanks very much.